Dissociative Identity Disorder in Fight Club by Tanvi Deshpande, MacKenzie Logan, and Radeya Siddiqui. Fight Club from 1999 is a movie about a man, Jack, who has a split personality named Tyler Durden and does not realize it. In order to cope with his dissatisfaction with modern society, he aims to create chaos in his structured world, rebelling against his corporate job and society's materialistic nature. The disorder Jack has is dissociative identity disorder, which is a mental illness characterized by the presence of multiple personalities, in addition to large memory gaps encountering forgetfulness, with breaks in consciousness causing an extensive inability to recall major personal information and daily actions. At the beginning of the film, Jack went to seek medical attention, yet his symptoms were simply diagnosed as insomnia. His behavior was attributed to a lack of sleep and was given no treatment, but was told to get natural sleep and exercise. However, with the development of a second personality, this diagnosis could change. We do not believe this disorder is diagnosed in all cultures because many mental disorders are dismissed or combined into one category. More specifically, in Asia more frequently than other cultures, people with mental illnesses are all labeled to be crazy due to the stigma that these illnesses aren't real and people are just acting abnormally. In our culture, many people believe that DID is not a real disorder due to the lack of education about the reality of this disorder and how to properly care for those who have it. Two symptoms Jack displays are amnesia and the exhibition of another personality. Amnesia is gaps in memory due to disassociation. An example seen in the movie is when Jack continuously asks Marla if they've slept together before, as he does not recall because his alter personality slept with her. Tyler Durden is Jack's other personality, yet every action Tyler performed was actually Jack. For instance, when they sold the soap or the entirety of running Project Mayhem. One symptom Jack does not portray is childhood trauma. Although the movie vaguely mentions that Jack's father dumps him, there's no clear connection as to how that played a role in Jack's dissociative behavior. Our proposed treatment plan would be psychotherapy that includes 3 phases. The first phase would be establishing safety, stabilization, and symptom reduction. The second phase would be to work through traumatic memories that triggered the initial symptoms. And the last phase is the integration and rehabilitation of Jack back into society. This is an appropriate treatment for DID because it reveals the underlying causes of the symptoms, as DID is not a mental condition that deals with hormones. The ethical concerns for this treatment are mainly whether the therapist respects Jack and is educated about how to treat someone with DID. Will they be able to be unbiased and impartial? Do they truly care for the patient, or do they just care enough to be paid? Jack may be hindered from receiving proper treatment due to the social stigma surrounding the disorder. Additionally, he was diagnosed with insomnia despite insisting to his doctor that there was something more. The doctors seemed unsympathetic for their patients. Overall, this is not an accurate portrayal of the disorder, although some symptoms reflected that of DID, such as loss in memory and an alternate personality. Jack's alternate personality interacted with him and even became a visual hallucination, which is not an accurate symptom of DID. Furthermore, there is no indicator of childhood trauma that Jack experienced that could have resulted in DID. Instead, it formed anxiety. Portrayals of DID in film influences people's perception of individuals with these disorders. Movies often portray mental illness, but not accurately. People usually believe what they see, as these movies influence people's understanding of mental illnesses. They are likely to dismiss DID as a joke and superficial.